Hey folks, it's Dr. Gerstmar. Just got done dropping my kids off at school and wanted to quickly respond to something I just saw. So if you've watched some of my other videos, you know that I am a fan of what's called vaginal seeding, a term I never heard before until I just saw a recent article come out yesterday warning against it. So in brief, vaginal seeding is the practice of putting some either gauze or cotton or something like that in the vagina to soak up some of the juices and, more importantly, the bacteria. And then for babies who aren't able to be born vaginally, whether it's C-section or something else, then swabbing the babies down, getting it in mouth, nose, and openings in order to get those bacteria in. Because face it, the way it is naturally supposed to happen is babies are pushed down through the birth canal, and in that process, in their mouth, nose, ears, all their openings, they get exposed to the bacteria that are in mom's vagina, and that's how they start to have their gut microbiome. So for babies that can't do that, we know, so if they're born by C-section, we know that their gut bacteria look a lot more like the skin, because those are some of the first bacteria they come into contact with, as opposed to the vagina, the vaginal bacteria. So I am and have been, if you've watched some of my other videos, you've seen a big proponent of trying to get those vaginal bacteria into the baby. And the easiest way, rather than just using probiotics, which I am also a big fan of, is just simply to get some of those vaginal secretions, those vaginal bacteria in. So a recent article came out with some docs warning about the theoretical dangers of doing that. Okay, and saying, holding off that this is some kind of crazy kooky process, or at least that's the tone that I got from the article. The thing that I took was twofold. One, I am so desensitized to bodily secretions and fluids and everything that I forget how many people consider the secretions of the body, whether it's poop or farting or the vagina or, any other armpits, any other part of the body, how it's considered gross or disgusting. People don't want to talk about it, see it, look at it. I understand that, but we have to face the fact that we are actually animals. And when it comes to these gut bacteria, that they are critically important for our well-being. So if you haven't listened to a recent audio podcast I put out, we talk about how it looks like more and more we're seeing in the first 6 months of life, the immune system takes a snapshot of the bacteria that are in the gut and basically programs itself to say whatever is in there is normal. And so much of what we're doing seems to be, trying to get rid of the bad bacteria and get enough good bacteria in. And we see that can be a very challenging process for some people. And it seems to be because that early life snapshot that was taken included not much of those good bacteria and quite a lot of those bad ones. So it's really important to me, when we talk about true preventative medicine, that we try and get as many healthy bacteria into the gut as possible and as few bad ones. So probiotics are certainly one way to do that, and I do encourage baby or infant probiotics, but I am a big fan of this vaginal seeding. So again, theoretically, they're making the point that if the mom's vagina is full of bad bacteria, then, sorry, just saw an accident on the side of the road. Thankfully, looks like everyone's okay. All right, if the mom's vagina is full of bad bacteria, then of course you're giving that to the baby. And so there's one in particular that they singled out called Group B Streptococcus, or GBS. So if there have been any pregnant women out there watching this and you're wondering, why did I get antibiotics either right before or during my labor? Well, it's because they found that you had GBS. And now a small percentage of babies that are born to mothers who have a lot of GBS in their vagina go on to develop serious, oftentimes fatal, blood infections, because that group B strep can get into the blood and can cause a fatal infection. And so docs play a game of better safe than sorry. We don't want to lose any babies, so they give antibiotics, right? Now, good news, bad news, we'll save it for another time. So the fear is, well, if mom has GBS, baby is born, and then you're, of course, then taking that vaginal seeding and giving it to baby, you could be doing the same thing of giving the baby GBS. All right? Possible, right? But we have to put this in context. So first of all, hopefully your doc has done a good job, either your OBGYN or your midwife or whoever you're using as your birth assistant has tested you for GBS to see if you actually have it, okay? And then if you do, we may need to question it. The other side is, look, if your vaginal flora or your gut flora are really messed up, then you may not want to give this to baby, right? So whether that's, if baby is born by C-section and you have a real dysbiosis or messed up gut flora, whether that's, you're having yeast infections or some other issue, or you have serious gut, imbalances, IBS, all that kind of stuff, IBS, IBD, other gut dysfunctions, autoimmune disease, you have to play one of those pros and cons. Is baby better off getting your gut flora? And the answer is, most of the time, probably yes, but sometimes probably no. So at the end of the day, is there a big danger in vaginal seeding? Well, looking at all available evidence, everything that we have that shows the critical importance of establishing a good gut flora, especially within the first 6 months. And right now, the mostly theoretical risk of harm if mom has dysbiosis or group B strep or some other nasty bacteria, to me, unless we have evidence to suggest that this procedure should not be done, I think it makes sense to do it. And in fact, in the link study, which we'll have put here, you can see a very small trial was done showing beneficial effect from doing the procedure. All right, so at the end of the day, 2 takeaways here. One, I often forget how sensitive people are to the body and things that come out of the body. And this is easier said than done, but personally, I think we need to get over it. We are a body, we live in a body. By ignoring it at best, we miss some vital clues about our health, disease, and well-being. And at worst, we completely cut ourselves off from this body that we have. So for everyone out there who thinks the vagina is gross or any of this is gross, I strongly urge you to start reconsidering and try and get yourself used to this is a part of your body, and ignoring it doesn't help, right? Doesn't mean you have to go play with poop or anything, but just recognize that none of you is gross. It is you. Secondly, should we be concerned about vaginal seeding? I think, given the available evidence, that vaginal seeding should be a regular part of care for babies that are not born vaginally, unless we have a specific indication to suggest that it is not a good idea. All right, so new term for me, vaginal seeding. There is my breakdown. Once again, you can find us at www.aspirenaturalhealth.com or or facebook.com/aspirenaturalhealth. At Aspire Natural Health, we focus on treating people with gut dysfunctions, autoimmune diseases, and other hard to treat cases. We never give up on people, and we are always striving to learn more, to know more, to be able to do more for patients. If we can help you, please feel welcome to contact us. Till we talk again, guys, take care.